Our nursing theorist was Madeleine Leininger, and this presentation is by Kennedy and Malia. She was born July 13th, 1925 in Sutton, Nebraska, and died August 10th, 2012 in Omaha, Nebraska. She earned several degrees, including a Doctor of Philosophy, a Doctor of Human Sciences, and a Doctor of Science, and she was a registered nurse and also a certified transcultural nurse, a Fellow of the Royal College of Nursing in Australia, and a Fellow of the American Academy of Nursing. She graduated from St. Anthony's with a diploma in nursing in 1948. In 1950, she earned a bachelor's degree from St. Scholastica College in Atchison, Kansas. From 1951 to 1954, she studied biology, nursing, administration, curriculum, and teaching at Creighton University in Omaha and earned the equivalent of a Bachelor of Science in Nursing. In 1954, she studied psychiatric mental health nursing at the Catholic University of America in Washington, D.C., and received her Master of Science in Nursing. In 1955 to 1958, she went to the University of Cincinnati, where she studied nursing curriculum in the social sciences. While there, she was an associate professor of nursing in the child psychiatric nursing program from 1954 to 1959. In 1960, she began her doctoral studies. The National League of Nursing awarded her a fellowship to study human behavior in the Eastern Highlands of New Guinea as part of her program. In 1966, she received a PhD in cultural and social anthropology from the University of Washington, and she was the first nurse to achieve that honor. In her career, after receiving her PhD, she joined the faculty of the University of Colorado, where she taught in the College of Nursing in the Department of Anthropology and was the director of the Nurse Scientist Program from 1966 to 1969. From 1969 to 1974, she returned to the University of Washington and was the dean and professor of nursing and also a lecturer in the Department of Anthropology. From 1974 to 1981, she held various positions at the University of Utah, including Dean and Professor of Nursing, Professor of Anthropology, and Director of the Center for Nursing Research and the Doctoral and Transcultural Nursing Programs. She spent her last years of full-time teaching at Wayne State University in Detroit, Michigan, and even though she semi-retired in 1955, she was still very active in teaching and promoting her work, and she was a Professor Emeritus at Wayne State University College of Nursing and adjunct clinical professor of nursing at the University of Nebraska and in demand as a lecturer and consultant. In her honors and awards, she was the recipient of many honors and awards throughout her career. She was the Professor Emeritus at Wayne State and the University of Nebraska School of Nursing. She was awarded honorary degrees from Benedictine College, the University of Indianapolis, and the University of Kuopio in Finland. Fellow of the American Academy of Nursing, Distinguished Fellow of the Royal College of Nursing in Australia, member of the Honor Society of Nursing, Sigma Theta Tau International, and in 1988 she was named as a living legend by the American Academy of Nursing.
Theory in the 1950s when she recognized the missing component of cultural knowledge in nurses' understanding of patients. The culture care theory defines nursing as a learned scientific and humanistic profession that focuses on human care phenomena and caring activities in order to help support, facilitate, or enable patients to maintain or regain health in culturally meaningful ways, or to help them face handicaps or death. The theory helps nurses be aware of ways their culture and faith influence their experiences about illness, suffering, and even death. This theory has developed into a discipline in nursing. She believes in understanding the similarities and differences in patient groups, helps nurses be able to be respectful of the diversity of people. She believes that there are three modes that guide nursing judgments, decisions, or actions in order to provide appropriate, beneficial, and meaningful care: preservation and/or maintenance, accommodation and/or negotiation, patterning or restructuring. Her theory makes the following assumptions. Care is the essence of nursing and a distinct, dominant, and unifying focus. Caring is essential for well-being, health, growth, and to face death. Culture care is the broadest holistic means by which a nurse can know, explain, interpret, and predict nursing care phenomena to guide nursing care practices. Nursing is a transcultural, humanistic, and scientific care discipline and profession with the central purpose to serve human beings worldwide. Caring is essential to curing and healing. There can be no curing without caring. Culture care concepts, meanings, expressions, patterns, processes, and structural forms of care are different and similar among all cultures of the world. Every human culture has lay care knowledge and practices, and usually some professional care knowledge and practices which vary transculturally. Culture care values, beliefs, and practices are influenced in the context of a particular culture. Beneficial, healthy, and satisfying culturally based nursing care contributes to the well-being of individuals, families, and communities within their environmental context. Culturally congruent nursing care can only happen when the patient, family, or community values, expressions, or patterns are known and used appropriately and in meaningful ways by the nurse with the people. Culture care differences and similarities between the nurse and patient exist in any human culture worldwide. Clients who experience nursing care that fails to be reasonably congruent with their beliefs, values, and caring life ways will show signs of cultural conflicts, noncompliance, stresses, and ethical or moral concerns. The qualitative paradigm provides new ways of knowing and different ways to discover the epistemic and ontological dimensions of human care. How the theory works. It helps nurses determine if the patient is using any at-home remedies or if their cultural background is influencing their health. The assessment should include a self-assessment to understand the nurse's own culture. The assessment addresses the following: communication or language, gender considerations, sexual orientation, ability and disability, occupation, age, socioeconomic status, interpersonal relationships, appearance, dress, use of space, food, and meal preparations, and related life ways. It helps nurses determine how one's cultural background is involved in their health and be able to use that knowledge to formulate a nursing plan that will help the patient while still being sensitive to their cultural background. And here is our demonstration. Hello, my name is Malia. I'm going to be your student nurse today. Can you go ahead and verify your name and date of birth for me?
Hello, my name is John Doe. My birthday is 5/5/2000.
Okay, Mr. Doe. Today we are going to talk about controlling your hypertension. I see here that you've been using garlic. Is that correct?
Yes, it is. In my culture, we use garlic to reduce blood pressure.
That is very true, but we still recommend taking an antihypertensive medication as well. This will hopefully increase the desired results.
If it helps get the results I need, I can do that.
Awesome. Okay, Mr. Doe. I think that's all I have for you today. Thank you.
Thank you.